Hello everyone, I'm Associate Professor Chris Ifediere of the Griffith University School of Medicine in the Gold Coast, Australia. I'm also the President and Founder of the OCI Foundation International. This part of the presentation for the ArOY Youth Health Campaign, and on this occasion we're looking at the capacity building for NYSC staff ahead of the ArOY Youth Health Campaign introduction into the regular corps members' orientation activities across all the 36 states of Nigeria and the FCT. We are going to look at an overview of this program. It's a bit of an outline as to what we're going to look at of what this course is entirely about. So this is course 3 of the OCI Foundation's online program. First, we're going to talk about the OCI Foundation, and we're going to look at overviews 1, 2, and 3, and finally we'll end this presentation. So this is basically just an overview of course 3, which relates to the NYSC capacity building. There'll be a few quizzes at the end. First, about the OCI Foundation. So Onyebuchi Chris Ifediere OCI Foundation is an international NGO registered in Nigeria back in 2016 and in Australia 2 years after that. It's a charity, not-for-profit and non-political, non-governmental organization that was formally established for Nigerians for 3 good reasons. Number 1 is to promote and advance health, and then to promote education, and finally to promote social and public welfare. The ArOY Youth Health Campaign is a flagship health initiative which falls under the very first leg of the tripod, the promote and advance health. It was designed with the help of the Harvard Medical School in the USA and has the support of the World Health Organization country office in Nigeria. In addition to this, the program was developed with the help of experts from 4 different universities, including the University of Griffith in Australia, the Universities of British Columbia and Saskatchewan, both of them are in Canada, and then Nnamdi Azikiwe University in Nigeria. This is in addition to the input from the Harvard Medical School, already mentioned. Now, this campaign aims to introduce anti-breast and anti-cervical cancer teachings into the curriculum of all senior secondary schools in Nigeria. This is the primary aim of this campaign. But in addition to that, it also aims to integrate these principles into the regular orientation activities of all the 36 NYSC camps in Nigeria alongside the FCT. Now, this whole program is all about fighting breast and cervical cancers using initiatives that are novel and evidence-based and designed to be realistic, to be cost-effective, to be very impactful and effective, wide-reaching, culturally acceptable, and sustainable. So all these features mentioned are part of what this program is designed to be. It's realistic, it's cost-effective, very cheap, it's not expensive at all, and it's designed to have huge impact and to reach every single Nigerian in ways that are culturally acceptable. So irrespective of religion or tribe or location in the country, this program is designed to fit you and also sustainable so that it outlasts both the OCI Foundation and the NYSC and every other institution that's currently designing it now. Now, the course in question, course 1, like I mentioned, this is about the OCI Foundation and the NYSC and then the Nigerian Cancer Society. All 3 groups are part of this program. This training is designed to enable selected NYSC staff in all of Nigeria's 36 states and the FCT to undergo a training or what you call capacity building. This capacity will allow them to anchor the sensitization of the core members posted to their respective states. So to anchor the ArOY Youth Health Campaign in their respective NYSC orientation camps. Such anchoring, it's very important to know, does not require the NSC staff to teach the corpus. No, far from it. We're not building this capacity to teach the corpus. The corpus are already very intelligent, they're already graduates. Rather, this program is designed to equip the NYSC staff with the tools to easily sensitize the core members on breast and cervical cancer preventive measures. Now, it's mainly to draw their attention to the benefits and principles of the ArOY Youth Health Campaign, which we're going to talk through as we go down this course. So it's to draw their attention and to stir their curiosity and stimulate their interest. It's not to teach them, it's to guide them, to point them out, to draw their attention, to whet their appetite. And also to the existence of the OCI Survey Breast app, which is freely available on both the Android and the Apple Play stores. Now, still about this course, second set of points. It is 100% free to all NYSC staff. Even though we are selecting 2 per state, it's available to every NYSC staff that wishes to be part of this program. Minimum of 2 NYSC staff will undertake it from every state. But like I said, any staff can join, and it is very free to every single person. Now, these trained staff will anchor the program for each state during the NYSC orientation activities, the 3-week orientation activities, and the course is supposed to be completed at the participants' convenience. And this is the beauty of this program. So even though it's online, it's designed to be very flexible and to suit every participant's schedule. So you do it at your own convenience, wherever you are, in your bedroom, in your toilet, in your dining room, at your workplace, in the library, anywhere you are and wish to take this course is designed to suit that convenience. Once you start it, we expect it should be completed within 30 days. That's another beauty of this program. I mean, we can do it in a workshop area over an 8-hour period, but if you miss it, that's it. But with this, you have 30 full days to do this program as it suits you. It can be finished earlier if you like if you decide to go through it without stopping, you can do this program in 4 hours only at a stretch. But we want to break it up so that it's easy for you the way it suits you. You can log in and log out at your convenience, and whenever you do so, you start from wherever you stopped. The lessons, the quizzes, the modules are automatically saved when you log out. So whenever you log back in within the 30 days, you'll still start where you stopped. Any mobile phone with internet or computer can be used for this. So you can go to a cybercafe if you don't have a computer, or you can do it with your smartphone. The OCI Foundation will be providing logistics to assist with this training. This course can be accessed as PDF. So that's another beauty of this program. So you can just download a PDF version of the program, read it offline, and then return to complete the quizzes later on. And that way it does not cost you much. Now, it can also be just watching the videos. This video, you can just watch it and not bother to read the PDF, or read the next one, which is option C, to read the embedded text on the web page. Now, either way, all 3 options contain exactly the same information, and all you need to do is when you finish, you do the quizzes online. About this course, third point, on completion of this course, for all NYSC staff that will be part of this, an automated but personalized certificate will be issued at no cost to the NYSC staff. All the 3 modules and the accompanying quizzes must be completed. Now, there are 3 modules to this course. So all 3 modules will be completed along with the quizzes attached to them. In addition to this, any NYSC staff that aims to get a certificate must obtain a minimum pass score for the final, which is 70% and very easy, and it gives you the answers basically. But all we need to do is to make sure that everyone is engaged with this program before you get the certificate. It's not designed to test your intelligence, but to ensure that you engage with the program. Now, the curriculum was developed with inputs from experts within and outside the OCI Foundation, as already mentioned, and is designed to be easy, to be engaging, to be effective, and to be sustainable. So the beauty of sustainability is, if in the next 2 years the current NYSC staff being trained resigns, this program will be there for new staff to just log in. They don't even need to contact the OCI Foundation. Just log in, complete it, and obtain the certificate and present it to the national headquarters. And then you're able to anchor this program. It is the beauty of it. We don't have to now spend resources trying to retrain future NYSC staff. In the next 10 years, this program will be available online. That's what we mean when we say it is sustainable. Now, there are provisions for feedback for the course participants. Now, the OCI Foundation is constantly seeking to improve. So we've made this provision so that when you complete this course, or at the completion of any lesson in this course, you can provide feedback straight to the OCI Foundation on what you found wrong, or what you found good, or what you found very good. I mean, things to strengthen on, to consolidate on, or to change completely. We're very much open to any input from anybody. Now, as part of this course, we have some benefits for the core members, and I have to put this in the overview because we want to be sure that everyone understands this upfront, and that the NYSC staff should be able to begin to assimilate it, because we need to be able to pass this on to every core member in Nigeria. There are multiple benefits to the corpers themselves, and this should be highlighted to them, particularly if they undergo trainings on the other courses being offered by the OCI Foundation. So we have 2 other courses, 3 in total, and if they're able to undertake that course, there are lots of benefits associated with this ArOY Health campaign for the core members. The details are in Module 1, but I'll outline them here. First is personal health gains for the core members and for their families. Financial gains are also there. Then it also prepares core members to join the wider ArOY Health campaign in different secondary schools in Nigeria. As we mentioned, this program, is for senior secondary schools in Nigeria, and any core member that gets trained or prepares him or herself can actually be part of this ArOY Health campaign overall. It also gives core members the opportunities or the options to develop their community development project. As part of their NYSC service here, they can channel this or turn this particular program into their CDS projects. It also helps to improve their employability prospects and also improve the chances of their foreign recognitions for those who want to study abroad or undertake employments abroad. Finally, it brightens their chances of joining the OCI Foundation. We've had a lot of people requesting to join the OCI Foundation. Undertaking this program puts you right on course to do that. Finally, the cost, the structure of this course. Again, this is all part of the overview. As stated, there will be a certificate issued and it will be free of charge once all the modules are completed and the minimum pass scores for the accompanying quizzes are attained. Each module has accompanying lessons, videos, and quizzes. The videos contain the same information as the lesson text or as the PDF files, and you can use one or the other. You don't have to use all of them. That's the beauty, so you can save costs. At the end of all 3 modules, says 4, but I actually mean 3 modules, there is a final quiz. Now, here are the 3 modules. First is the module 1, which is introduction, benefit, and sensitization steps and strategies to be employed in delivering these programs at the NYSC camp. Then there will be brief talks on cervical and breast cancer so that these are anchors who will know exactly what they are doing and what they're talking about. And finally, module 3, we'll talk about the Savvy Breast app, the mobile phone application, so that you have the details of what that app is all about. Finally, there's the quiz. It's not a module, but you can call it the 4th module. It's a quiz compulsory before you get a certificate. So you can actually do this course without taking the certificate, and that's fine. But if you're going to be an anchor, you need to get a certificate, and the final quiz becomes compulsory. But like I said, don't worry. It is very easy, and anyone can actually do it. So this is the end of this overview. Thank you very much for watching this video and for being part of this program. Let us all join our hands to arm our youths. Let's do it while they are young, as youths of the country. Let's do it for every single one, every single corper, every single youth in Nigeria. And let's start right now. We can do this for our families. We can do this for our states. And we can do this for our country, Nigeria. Thank you.